Hi, I am Dr. Erin Persant, and I am a neurologist and culinary medicine specialist, as well as board certified in lifestyle medicine. Um, so I specialize in, or have had a specialty in neurology of movement disorders, which is mainly Parkinson's disease. So I've worked with a lot of the older population. In neurology. And one of the reasons I kind of turned to culinary medicine and lifestyle medicine was because of um, the lack of really good or impressive treatments for neurodegenerative diseases as people get older. And so I wanted to be able to provide something that um, maybe brought a little bit more hope and into people's lives and also help them to feel better overall. And I found that in lifestyle medicine and culinary medicine, bringing those neurology and those disciplines together. So that's a little bit about me. I don't know. Do you want me to just go ahead and continue or? Okay. Um, in thinking, oh, did you want to say? Okay. In thinking about, what to say, I think one of the most important parts from a neurologic standpoint in bringing in healthy eating and exercise into somebody's life, and what I always try to tell people is really start small. I think a lot of things that we see in the media and elsewhere that are telling us like you have to make these huge lifestyle changes in order to do whatever you want to do. But that really goes back to this like horrible diet culture that we used to really have in like the 1990s, where it was like crash diet, no carbs for, a week, and then lose all this weight and you'll be better, right? And then immediately after that, we go back on whatever we were doing before, and no real changes happen. So whenever people are trying to make changes in their life, doing that for your brain is really kind of a long game. So making small, sustainable changes along the way are what's going to be best. Doing crash dieting or crash exercise programs, going from being completely sedentary to 7 days a week of exercising, you'll only maintain that for a little bit. And then most likely, most people will revert back to what they were doing because they'll get burned out. So if you make like a little bit of a change every single day or once a week, then it'll be a lot easier to sustain it. And I think that that's where most people go wrong in terms of trying to make these changes. Especially, when we're talking about neurodegenerative diseases, which we see mainly as we get older, but there are other ones that affect younger people too. But like Alzheimer's disease and Parkinson's disease are the two biggest. And then there's multiple sclerosis and Huntington's disease, other things like that. Again, we won't see huge changes in the disease process immediately, right? These diseases progress over many, many years. And so you have to know that by doing the right thing for your diet and your exercise at that time is helping you for many years to come and many years down the road. So the evidence, the background, the research in neurology on lifestyle and dietary changes and what we should eat is all relatively new, and a lot of it's not, a lot of it's correlations and associations. But what we do know is that following a diet that is high in dark leafy green vegetables and berries, and the more colorful the better for the food, all those great antioxidants and polyphenols. We know those are really good for the brain. They help to reduce the oxidative stress and the inflammation that we see in the brain, just like it helps the rest of your body. If you're helping your heart, you're helping your brain too. If you're helping your metabolism, your glucose, you're helping your brain as well. And so all of those principles are what we are really trying to reinforce for people with neurologic diseases too. And I think that that spans from, kids with ADHD to adults that are trying to prevent or improve their prognosis with Alzheimer's disease. On the kids side, the ultra processed foods and the artificial sweeteners and artificial colorings have been linked to behavioral problems or worsening symptoms in ADHD. And we know that those ultra processed foods are not good for the brain all the way up until 80s, 90s. It doesn't help us think any better. So, I think that that's where people need to start is making small changes with their diet every day, and really evaluating how many ultra processed foods they're taking in one day. I think we don't necessarily realize how much ultra processed food we're eating until we start paying attention to it and replacing your ultra processed snack with a food that you enjoy eating, that is easy for you to get, that is within your price range, but that is not ultra processed is, I think, a good place to start. Our snacks tend to be the worst for us, right? The chips and the cookies and the crackers and all of those things that we consume. So, in terms of like really being able to make the shift, starting, identifying one place in your diet where you're consuming the most ultra processed foods and trying to come up with an alternative is a great thing to do. For people who think that it's too expensive or too time consuming, there are definitely those aspects of trying to change your diet, which can be difficult. And I think that that's where culinary medicine is like really exciting because you can talk to somebody about what is your life like and how can we put this paradigm of eating into your lifestyle, right? So if that means you have a certain budget, we can find foods that you can eat on that budget. It's going to take a little more planning and a little bit more work, but at the beginning. But if you get into a routine of it, it can be done. And this spans across the whole family, right? From the mom who teaches the kids to eat like this, or maybe it's the kids who's teaching the mom to eat like this, to the grandparents, to the dad, to the brothers, to the sisters, everybody, it will trickle down in the whole family. So it's really important to shift those behaviors, and it helps if the whole family can get on board with that. So, um, oh, let's see. Oh, you're on mute. Sorry.
Thank you. You brought a very important aspect of eating healthier, changing our diet. And I was going to ask you the question
Yeah.
regarding a family who's on a low budget. How will they be able to afford it? But you mentioned that you have to gradually work with them
Yeah.
and plan a way how they could eat better, which is
Right.
great. I also wanted to ask a question. Could you explain to us the steps that you take in one of your clients who have been struggling with this disease and the before and after, if you have seen any improvement in the way
Mhm.
they behave and if their lifestyle has changed
Yeah.
since they changed their diet? You don't have to call names, just give an example of A or B or C.
Sure.
You could
Yeah.
walk us through the progress from beginning, meeting with them, explaining to them how they react to the change
Mhm.
and how long it took them to finally accept that they have to change their lifestyle.
Yeah, that's a good question because I think that's something we struggle with, right? Is
Mhm,
convincing somebody, but we all kind of have to understand that the benefits are
mhm,
are actually going to outweigh it's not really risks, but the
mhm,
the amount of energy you're putting out there, right?
mhm,
So
mhm,
if you're told, oh, you have to eat better and exercise better, our brains automatically are like, is that going to be worth it? I don't think so.
mhm,
So when I meet a patient, or I can think of a patient that I met who came to me with Parkinson's disease, relatively young, like 65, but was already having pretty severe symptoms of tremor and difficulty walking, had gained some weight because he had become less active since his diagnosis. And that was in part due to a mood shift as well from the diagnosis, a little bit of depression about it and anxiety. We had a number of meetings where we managed medications, but where we talked about you need to, what's really going to help is getting some exercise, which is one of, from a neurodegenerative standpoint, from a Alzheimer's, Parkinson's standpoint, the exercise has really been shown to be one of the top things you can do for your brain, in addition to changing your diet. So, he wasn't eating really well, a lot of snacks and without a lot of meals that were nutrient dense. And so I would say maybe it was 4 or 5 appointments where his wife would come with him and say, I can't get him to exercise. I can't get him to do this. And, so we talked about little steps every time that he could take. And eventually, he was able to sign up for a class, a neuroboxing class, which has been shown to be
Mhm.
helpful. And we convinced him, like, just go one time, try it, go see what it's like, right? And he ended up going, and he ended up really liking it. So he started going one time per week. And just by going that one time per week to an exercise class, he started feeling better and he started choosing healthier foods to
Mhm.
eat, right? So, movement also helps your brain and your body kind of crave better foods for yourself too. Because if you're eating a lot of ultra processed foods and sugar and junk, you don't feel like moving very much because it's not helping your body.
Mhm.
Feel better. So he started exercising just one time per week, right? For an hour, and he started eating a little bit better. Then because he started eating better, he felt his mood felt a little bit better. Like he felt like, oh, I'm actually doing a little bit more. So he joined the class for 2 days a week. And by 3 months out, he had started doing his boxing class 3 times per week. He had started eating 3 meals per day that his wife was cooking, and he was watching what he was, he wasn't eating a lot of ultra processed foods. His mood improved significantly. He was able to come off
Mhm.
antidepressant medication, and he lost a bunch of weight. So, I would say from the time that we kind of started talking about
Mhm.
shifting lifestyle habits, exercise, and diet, it took a year at least to get him to a point where he was actually participating in these activities and willing to shift his diet. And maybe another couple appointments after that where he was able to say, this has actually really made a big difference in my life, and for him to stay on that program. But it was slow, but once his brain accepted that this was helping him to feel better, he was all on board with it and became like the
Mhm.
biggest proponent of the boxing class and the dietary shift with his other classmates and things. So it's so exciting to see, his walking improve. Like he had been walking with a cane and
Mhm.
came back to clinic not with a cane. And, in Parkinson's or neurodegenerative diseases, we don't tend to see that too much, right? Because by the very
Mhm.
definition, they're progressive. But he had felt so much better that he was actually able to improve his symptoms, which was great.
Oh, that's a great story, Dr. President. I love it. I have another question I would like to dig into. I know we had mentioned it before when we talked before on Zoom, the little introduction. Do you feel that the hospital and health facilities have nutritious food that they give to the patient, or it needs to be improved and a lot of people need to get on board and collaborate?
Yeah. Yeah, I mean hospitals, as well as I would say like assisted living facilities or places that people end up living as they get older. No, the food is the food is not good.
Okay.
Yeah, I mean, actually, there are hospitals in New York are really working with like chefs and other people to upgrade
Mhm.
the food, which is wonderful, you know. And I think there are even some hospitals that have gone entirely plant-based there in New York,
Yes. Mhm.
which I think is an amazing feat. And I think that that's awesome because what happens is people get admitted to hospitals or they get sent to these rehab facilities or things after a hospitalization. And then we pump them full of like really processed kind of
Food. Mhm.
not nutritious foods, and we expect their bodies to heal and do well, and that's just not going to happen, right? And so I do think that there needs to be a focus on really leveling up some of the food that are given in these facilities. Even, in my area, there are some quite expensive retirement communities that have independent living, but like all the way up to memory care and in the cafeterias, they serve a lot of breaded, fried
Wow.
foods. And I'm thinking, these people pay so much to be here.
Mhm.
If if people who can pay a lot are still
Right.
eating this
Exactly.
stuff, what are we doing? So I think there's a huge disconnect between, what needs to be happening to feel good and be healthy versus what actually is happening out there. And there needs to be a collaboration between, I mean, chefs and doctors and, dietitians, nutritionists. Like there needs to be a whole group of people or a consensus that comes, out and people can follow those guidelines. So
I totally agree. And those,
run or, the state facilities, those foods are going to be even probably worse. It's the same as, the school lunches, for instance, public school lunches too, which I know New York is
it's
like
moving. Hmm.
doing really well on, which is awesome. But sometimes my daughter's 8 and like I get the menu and I think, what, why are they giving them a cinnamon bun for breakfast, for kids who that's like their meal for, the morning, they're
Hmm.
getting a cinnamon bun. And that's what we're teaching them to eat. That's what we're priming their brains to want is that sugar. And there's so many things that we should be changing about that.
Right.
Yeah.
In New York, it's really improving with the cafeteria. My grandson doesn't like to eat vegetables home, but for lunch, he eats the vegetable in the school because I think it's the environment, all the kids are eating it, and he's a one child. My son eats vegetables, my daughter-in-law, but it's the environment you have to put the young people in, so it's going to motivate them to eat. Oh, this is great. I'm so glad you mentioned something going back about the client exercising in boxing. I was just having a conversation before I got on board with a friend of mine. She has a brother in St. Vincent and he suffers from neurological disorder. He's 31.
Okay.
So I'm going to refer this piece of advice. Maybe he needs to join a gym and even do walks because they're in the Caribbean and the weather is
Oh,
right there. So he could start walking and exercising. So thank you for that tip. I want to jump onto something I really love on your website.
okay.
I did my investigation.
Uh-oh.
I took a picture of it. I love your website. It's very easy to navigate. Let's see. I just want to, I love it. Yeah, I have it. I really love at the bottom of your website, it's written, why focus on lifestyle? There is mounting evidence that lifestyle modification at any age can and will make a difference to your long-term brain health. Focus on your current symptoms and your long-term brain, which I love. I always tell people it's never too late to exercise. So I really, really love this at the end of your website.
Oh,
So
thank you.
this is part one of you giving us the information on the experiences and knowledge on helping people. So I'm looking forward to part two so we could continue this conversation in order to educate humanity on doing the simplest thing and taking your time. It doesn't happen overnight. Changes come. You have to start little, climb up the mountain until you get to the top. And we
Right.
don't want anyone falling down. You stay on top and take care of your health. Thank
Right.
you. It has been wonderful
Right.
having
Thank
this
you.
conversation with you. Have a great evening.
All right, you too. Take
Bye.
care.
Thank you. Bye bye.